Hi, my name is Sarah Bagley. Today, we're going to talk about how we can meaningfully involve affected family members in reducing alcohol use. In this mini video, I will summarize the importance of involving family members in supporting patients' alcohol reduction goals while maintaining confidentiality and patient trust. Before beginning, I want to highlight that a first step can simply be to be open to including family in visits or in the development of treatment plans. Many patients benefit when loved ones participate, and you'll see that there are certain principles to consider to ensure we always approach this with sensitivity and respect for the patient's comfort level. As providers, we often only see our patients for brief moments, a 20-minute visit, a follow-up call, maybe a check-in every few weeks. While those interactions matter, it's also true that they're just a small part of the patient's world. Our patients live within families and social networks that play a major role in their day-to-day experiences. These relationships can influence how ready they are to seek help, how supported they feel when they're making changes, and how consistently they stay engaged in treatment over time. Supportive family members can encourage healthier routines, celebrate progress, reduce isolation, and help maintain motivation. That's why involving family, when appropriate and with patients' consent, can be so powerful. Research consistently shows that family participation improves engagement in care, strengthens adherence to treatment, and lowers the risk of relapse. In other words, bringing supportive family members into the process doesn't just add to treatment, it actually enhances treatment outcomes. So when we think about the limited time we have with patients, partnering with the people who support and love them the other 23 hours of the day can meaningfully extend the impact of our care. In addition to the benefits for our patients, it can also improve the health and well-being of the family members themselves. Just like our patients who use alcohol or drugs often face stigma, their family members frequently carry their own burden of shame, stress, and isolation. They may feel responsible for the problem, unsure how to help, or overwhelmed by the impact substance use has had on the household. Research shows that the family member's physical and emotional health is directly affected by a loved one's alcohol or drug use. But importantly, their health can also improve when they're actively engaged in care, not only as supporters, but as individuals who receive guidance, education, and connection. When we involve families thoughtfully, we're not just strengthening the patient's recovery system, we're also offering healing, support, and empowerment to the people who have been navigating this challenge alongside them. Next, we're going to talk through a couple of patient cases to highlight opportunities to work with families. The first case is a 24-year-old woman who you're seeing for follow-up about her binge drinking. 3 months ago, she told you that her goal was to drink less on weekends when she goes out, but she still wants to drink socially. Today, she explains that she still has that goal, but cutting back has been harder than she expected, and she asks if you have other ideas. A helpful way to respond might sound like this. Thank you for being honest about how things have been going. It makes sense that cutting back can be harder in real life situations, especially when drinking is tied to social time or stress. The good news is that there are several strategies we can explore together. We can talk about things like planning ahead before you go out, alternating alcoholic drinks with non-alcoholic ones, or setting a time limit before the night starts. We can also think about what makes it harder to stick with your goal, whether it's certain friends, certain environments, or certain feelings that come up. And you might add, what's most important is that your goal hasn't changed. You still want to cut back. And the fact that you came in today and asked for help shows you're still committed. Let's work together to find strategies that fit your life and feel doable for you. This approach validates her effort, normalizes the challenge, and opens the door to collaborative problem solving. As you're talking with her, you mentally run through the different tools you can offer her to help her reduce her drinking. You remember she lives with her partner. Since supportive relationships can play a big role in behavior change, you decide to explore that option with her. You might say something like, I'm thinking about additional ways we can support you in reaching your goal. You've shared before that you live with your partner. What would you think about inviting them to join us for part of a visit? Sometimes having a supportive person in the room can make it easier to follow through on the changes you're trying to make. It could give them a chance to understand your goals and support you. This keeps the decision completely in her hands while opening the door to family involvement as a potential tool to strengthen her efforts. Before inviting the partner into the visit, it's important to take a moment with the patient to lay some groundwork. First, set clear goals for the partner's involvement. You might ask, what would you want your partner to understand about your goals? How would you like them to support you? This helps ensure that the conversation remains patient centered. Next, explicitly talk about what's okay to share and what she wants to keep private. This step is crucial. It reassures her that she's in control of the information and maintains trust and confidentiality. Once you've agreed on those boundaries, explore concrete ways her partner might help cut back on her drinking. For example, they might decide to reduce their drinking together, keep less or no alcohol in the home, or plan weekend activities that don't revolve around alcohol. These small shifts can create a supportive environment that aligns with rules. Finally, make a plan for follow-up. That might include checking in at the next visit about how involved the partner felt, what worked well, and what adjustments are needed. Setting that plan helps ensure the support continues beyond just one conversation. Okay, now let's transition to the next case. This patient is a 45-year-old woman presenting for a well woman exam. She had a positive screen on the GAD, and as you share the results, she tells you that much of her anxiety is related to concern that her partner might relapse. Her partner's been in recovery from alcohol use for 10 years, but recently lost her job and seems more depressed. It's clear that your patient's worry is impacting her own mental health, and she's seeking support and guidance. In this situation, it's helpful to first validate her concerns. You might say, it makes sense that you're feeling anxious. Supporting someone in long-term recovery can be stressful. Changes like job loss or mood shifts can understandably increase worry. The key here is recognizing that the patient's health is important, and that involving family support isn't just about the patient in recovery. It's also about addressing the ripple effects on loved ones. You notice that your patient's anxiety about her partner is causing significant stress, and you are thinking about ways to support her. And in situations like this, reflective listening and affirming are very powerful tools. You can explore ways to support her own well-being while still being sensitive to her partner's recovery. This could include discussing coping strategies, connecting her with behavioral health support or peer groups for family members, and identifying healthy ways she can provide support without overextending herself. You might start the conversation by saying something like this. Sounds like it's really hard when you're worried about your partner. They've been in recovery for a long time, and with the recent job loss, you're reminded of some challenging moments in your marriage. This approach does a few things. It validates her feelings, shows that you're actively listening, and normalizes the stress that she's experiencing. From here, you can begin to explore next steps together, whether that's identifying support for herself, discussing ways to engage her partner in a supportive way, or connecting with resources for family members of people in recovery. Starting with reflection and affirmation helps the patient feel heard and lays the foundation for collaborative problem solving. Once you've validated your patient's concerns and built rapport, the next step is to identify opportunities to open a discussion about her partner's mood and potential depression. You might ask her how she notices changes in her partner and explore whether she feels it would be helpful to talk together about support strategies. At the same time, you can encourage engagement in community-based mutual help groups. Programs like Smart Recovery or Al-Anon provide structured support for family members of people in recovery, helping them feel less isolated and giving practical strategies for coping. Additionally, it's important to offer a referral for professional support if indicated. Connecting her with a behavioral health clinician can provide targeted strategies for managing anxiety, stress, and family dynamics. Finally, scheduling a follow-up with you ensures ongoing support and allows you to check in on how she and her partner are doing. Taken together, these steps create a multi-layered support plan, validating the patient's concerns, connecting her with peers and community support, and ensuring professional guidance, all while keeping her engaged in her own care. As you're having these conversations, you might have questions about confidentiality and consent. It's absolutely possible to involve family members in treatment planning while still maintaining patient confidentiality. The key is always to get the patient's permission and to be transparent about what information will be shared. A simple way to introduce this is to say something like this. With your permission, I'd like to invite your family to join us for part of the visit. If the patient agrees, it's important to obtain explicit written consent that covers the sharing of protected health information. This consent should clearly outline what components of the assessment and treatment plan can be shared so that both the patient and family member understand boundaries. By taking these steps, we can engage family as allies in recovery while respecting the patient's privacy and autonomy. You can ground yourself in the following questions as you think about working with families. What does the patient want? Who do they trust? How much information are they willing to share? Consent is not a form, it's an ongoing conversation. In the next couple of minutes, I want to summarize what we've talked about today and highlight a few key points. First, family engagement and goals around alcohol use can simply mean being open to including family in visits or development of treatment plans. Some patients may find it helpful to have a supportive person present, while others may prefer limited involvement. It's important to assess what feels right for each individual. Second, when family is included, it's essential to develop a plan together about what will be communicated. This ensures the patient's boundaries and confidentiality are respected while allowing family members to understand their role in supporting recovery. Finally, for patients who are worried about a family member's alcohol use, it can also be valuable to provide referrals to behavioral health support or mutual help groups in the community. These resources give both patients and families guidance, coping strategies, and a sense of connection, reducing isolation and promoting healthier outcomes. As we wrap up, I want to challenge all of us. In your next patient encounter, pick just one concept from today and apply it. Maybe it's asking whether a supportive family member might join a visit. Maybe it's setting communication boundaries together. Or maybe it's offering resources for a patient who's concerned about someone else's drinking. Even one small step can strengthen trust and build a more supportive treatment environment. Family involvement can be a powerful tool to reinforce positive change. When families are engaged thoughtfully, they can provide support, encouragement, and accountability that strengthen recovery. Thank you.